For the first time in a long time, hope is in sight. The first of many shipments of COVID-19 vaccines are just days away from arriving here in Colorado.
So now we just have to convince people to take them. A recent study from the Pew Research Center found that only 51% of adults are willing to be vaccinated.
So what's the holdup? Well, for starters, plenty of people think the process has been rushed. And they are correct, although there are plenty of people invested in ensuring quality was not sacrificed for speed.
Now, others are waiting for the next guy to get it first. Now, that only works, though, if the next guy isn't thinking the same thing.
And some simply don't have faith in science or in institutions, and they will prove to be the greatest challenge. After all, if they won't put on a mask, what's going to convince them to roll up their sleeve and get a shot?
Well, we don't have the answers, but with more than 2,000 Americans dying every day and an economy this feeble, we need to find them soon.
Denver 7's Liz Gilardi begins tonight's 360 coverage.
It seems like every day there's a new headline about COVID-19 vaccines, but as we get closer to a release date, there is also more questions.
I'm getting a lot of questions.
Emily Cheshire is a family nurse practitioner and assistant professor. She's getting a lot of questions and says we won't have all the answers right away. When it comes to deciding if and when you get the vaccine, it's a conversation you need to have with your doctor.
What's the safety data we have right now for the vaccine that I have available in my refrigerator to administer to you today?
There's also other factors to consider.
What's your risk of getting COVID-19? How do you move through the world? What's your vocation? What's your exposure risk?
One of the main concerns she's hearing is about overall safety.
I get questions around the safety because it came out so quickly.
In a previous interview, we talked with Greg Dean, a CSU department head working on the vaccine. He says researchers are sharing more information than ever before, working toward a common goal.
This is a time for us to build the communication, relationship, and trust between scientists and the public.
In an attempt to convince people the vaccine is safe, former presidents Barack Obama, George W. Bush, and Bill Clinton promised to get the vaccine. It will be administered in a public setting to show not only the safety, but how important it is. After that announcement, viewers are weighing in too. Andrew writes, "I'll gladly get one to protect my friends, families, and neighbors." But Virginia says before getting the vaccine, people have to know the side effects.
This vaccine is a ticket out of this mess that we're currently in. So sign me up.
Elizabeth Carlton is an associate professor at the Colorado School of Public Health. She says the vaccine is a path forward.
Quite frankly, I would rather have a vaccine and have, a brief, uncomfortable stab in my arm than to end up in the hospital with COVID.
And when the vaccine becomes available, you'll ultimately be the one making the decision.
I trust the science. I have had to think through that myself, right? Much like as a patient.
Liz Gilardi, Denver 7.
And if you are taking a wait-and-see approach to the vaccine, you may be in luck that a lot of us are going to be waiting. Tri-County Health tells Denver 7 that Colorado is in line to receive an initial batch of 46,000 vaccines. It could arrive as early as the 11th. Of course, everything is contingent upon the FDA signing off. Right now, they plan on meeting on the 10th and discussing the vaccine made by Pfizer. Based on CDC guidelines, healthcare workers, nursing home staff, and residents will receive their shots first.